So today we're going to talk about the characteristics of autism spectrum disorders, also abbreviated as ASD. And we're going to discuss with you guys what these characteristics look like and what techniques and strategies are most effective to assist with the learning process with our clients. So first, we have an open discussion we want to do, and then we're going to do an example for which we want you guys to identify what you think the characteristic is. So for our open discussion question, what are some characteristics of ASD have you either learned at school or through the RBT process, or that you have either experienced within the field? Open discussion, Those are some great examples. Nice. So now we're going to do a multiple choice question, and we want you guys to respond according to what you think this characteristic is. So you're a therapist working with Alex, and you notice that he will spontaneously stare and flicker his fingers in the air. What characteristic of ASD is this called? A, perseveration, B, stereotypy, C, a tantrum, or D, nothing, he's just snapping his fingers. So let's see what you guys said. Those are some great answers. So the correct answer is B, stereotypy, which is defined as a self-stimulating act that is of rhythmic or repetitive form. This is also called stemming. I know you guys probably have heard that multiple times before. And other examples of stereotypy are arm or hand flapping, head nodding, or rocking back and forth. So now we're going to talk about what do these characteristics look like. So when children are diagnosed with autism, there are some specific difficulties that practitioners look for to make the appropriate diagnosis. So these characteristics of autism spectrum disorder are broken down into three categories: behavior, communication, and social. And I'm pretty sure you guys have seen at least one of these behaviors from these categories, or you may have seen one from each of these categories. So children with autism spectrum disorder often engage in uncommon behaviors due to their difficulty with responding to their environment. Most often, these behavioral characteristics can be observed because they are unable to functionally communicate their wants, needs, or feelings. Behavioral characteristics of ASD can include a range of behaviors such as self-injury like headbanging or biting, as well as two big behaviors which I'm pretty sure you guys have seen, such as difficulty with transitions and difficulty with attending or staying on task. Another characteristic is communication. Their difficulty with being able to communicate with others can be impacted due to speech impairments, or they may speak fluently but not functionally. So for communication, we often see behaviors such as echolalia, which is the repetition of words or phrases as someone speaks to them. So an example of that would be, I'm talking to my client and I say, "Hi, my name is Chanel." And they say, "Hi, my name is Chanel," when their name is really Samantha. Another example of a characteristic for communication is difficulty understanding prepositional locations such as next to, under, behind, etc. So characteristics of ASD as it's related to social skills can be seen in a client with them having either minimal or no eye contact. So you're doing everything to get this client to look at you. You're doing handstands, clapping, jumping jacks, and they will not give you anything. This is a very common characteristic for children diagnosed with autism. You may also see that they are resistant to being touched, or they can get too close and not fully understand the concept of personal space. One common one that I'm pretty sure you all may have seen in session is difficulty with responding or initiating social interactions with either yourself as a therapist or their peers and siblings. Their difficulty with being able to effectively and functionally communicate with others often impacts their ability to form social relationships and interact with others. You can pause it.